This section is about your pelvic floor. Now, you might be particularly interested in this section if you had a vaginal birth, and that's perfectly understandable. But there are some things that may be relevant to you if you had a C-section as well. But I'll include that in the C-section section so that you don't have to watch the whole thing. There are lots of weird feelings in your pelvic floor after giving birth, even after having a C-section. And it can be really scary. It's a really intimate area and we have no idea what's going on. This is all so new. This section on pelvic floor is to help you kind of navigate those changes, those feelings, those sensations, to help you identify what's going on and to give you as many strategies as possible to help you heal and not do any damage to your pelvic floor. This is quite a long section. There are quite a lot of videos in it. So this intro video is just to help you navigate all of that. Now, my first piece of advice when it comes to the pelvic floor is go and see a pelvic floor physio. Go and see a women's health physio. Absolutely nothing that you can learn in an online course can replace having an internal assessment by a trained professional who can create an individualized program, especially for you. There are a lot of things that you can do and you should be mindful of, and we'll go through all of that in this course, but please consider going and seeing a physiotherapist. It's really worth the investment. So the first thing I want to point out is that pelvic floors aren't always weak. They're a muscle, or is a group of muscles, and they can be weak and they can also be too tight. I like to talk about Goldilocks and the 3 pelvic floors. You can have a weak pelvic floor that's kind of low in the pelvis. You can have a too tight pelvic floor that's high in the pelvis, and you can have one that's just right. And we always want to aim for just right. I'm saying this because lots of women don't realise that you can have a too tight pelvic floor, and so they just smash away at their pelvic floor doing tons and tons of Kegels, and this is just making things worse. Now, if you've had a vaginal birth, the likelihood is that you will have a weak pelvic floor rather than a too tight pelvic floor, but we'll talk about all of that in the following section. Let's quickly run through some symptoms that you might be experiencing with a weak pelvic floor and with a too tight pelvic floor. So with a weak pelvic floor, you may be experiencing incontinence. There's lots of different types of incontinence. There's stress urinary incontinence, which happens when you sneeze or when you cough or when you laugh or when you jump and you just pee a little bit. Or it can just be frequent urinary incontinence when you just pee randomly and you don't know what's going on. You can have a difficulty contracting the pelvic floor. And you can also get something called urge, where you really need to pee all the time. Now, the confusing thing is that you can have all of these symptoms with a too tight pelvic floor as well. That might sound weird about the contraction, but the thing is that the pelvic floor is so tight and high in the pelvis that you can't contract because there's nowhere else for it to go. And the problem is that you actually can't relax the pelvic floor. Now, that might sound really confusing. How the hell do I know if I have a too tight pelvic floor or a too weak pelvic floor? Well, that's exactly the point. That's why you should be assessed by a pelvic floor physio who can check that for yourself. A few clues that you have a too tight pelvic floor is things like pain in the pelvis. Different pains in the hip and in the pelvis can often be because of tight pelvic floor muscles, although they could be because of weak muscles as well. Pain during sex is a really common sign. Difficulty voiding, something called hesitation. So when you go to the toilet to do a wee, you can't release your pelvic floor muscles. They stay really tight, and you need to be able to release those sphincter muscles in order for urine to come out. So if you go to the toilet, you're really busting for a wee, but you can't seem to relax enough to let it go, then that might be a sign that you have a too tight pelvic floor. Constipation is another clue that you might have a too tight pelvic floor, and hemorrhoids, because when we have constipation, when we find it hard to go to the toilet, we tend to bear down and push down onto our pelvic floor, which can cause little blood vessels to burst, and that's basically what hemorrhoids is. Now, like I said before, if you've just had a vaginal birth, it is very likely that your pelvic floor is too weak and not too tight. But I'm mentioning this because I've seen women who have done pelvic floor physiotherapy and they've been told to just do loads and loads and loads of contractions, or that they haven't done pelvic floor physiotherapy, they've just decided to do tons of contractions. And then they come to me a year postpartum with a bunch of complaints, and to me it sounds like they have a tight pelvic floor, so I send them to my pelvic floor physio who confirms my suspicion. Then they work on releasing the pelvic floor rather than strengthening the pelvic floor, and all of their symptoms go away. So I know that might sound really confusing. Hopefully this will become clearer over the next few sections. But what I want you to take away from this video is just an awareness of these different problems, which we'll talk about how to address in the following videos. We'll go into more depth on some of these topics in the following videos. And the final takeaway is please go and see a pelvic floor physiotherapist. One final thing that actually needs to be mentioned in this video is something called POP, or pelvic organ prolapse, and that's where the abdominal organs fall into the vagina or rectum and can kind of descend down towards the pelvic floor. And this can create a feeling of heaviness, it can create some of the symptoms that we talked about before, and it can have no symptoms. It's important to know about POP, it's important to sort of know what sort of feelings you should be looking for or be wary of when you return back to exercise. And you should know that there are treatment options available for it. POP can be really, really benign, where you just have a grade 1 prolapse and really nothing happens, nothing's wrong, and you can live like that for the rest of your life, all the way to a grade 4 prolapse where the organs actually protrude out of the vagina, and that can be really quite debilitating. There are surgical options available, but for anything from a mild to a more severe prolapse, pelvic floor physio can really help. So if you have any signs of heaviness or bulging in your pelvic floor, any feelings of like a tampon, that's something that you really want to get checked out by a pelvic floor physio who can help you address those issues early on so you can nip it in the bud. A lot of the things that we're going to talk about in this next section, in the breathing section about regulating intra-abdominal pressure, are going to help avoid or prevent worsening a POP. But it is important to mention, it's something that you should know about that can happen postpartum.